In the winter of 1894, the streets of New York City were blanketed in a thick layer of snow. It was a time of immense noise, and energy carriages rattled over cobblestones. Factory whistles blew, and the city hummed with the sound of progress. But inside the cold stone walls of Bellevue Hospital, a strange and unsettling silence followed one particular patient. His name was Samuel Hart, at 28 years old. Samuel looked utterly ordinary. His shoes were worn, his hands were calloused, and his clothes had been patched more than once. He was the kind of man you might pass on the street and never look at twice. But the moment doctors began to examine him, they knew they were looking at someone extraordinary. Samuel hadn't come to the hospital because he was in pain. He came because he had never felt pain in his entire life. Dr. Albert Jenkins was the first to take Samuel's hand. He immediately noticed something was wrong. The hand was covered in old burn marks, deep scars, and even a poorly healed fracture that had left one finger bent at a crooked angle. Yet, as Samuel described his life, he spoke calmly, almost politely, as if these injuries were just minor details, things that had happened to someone else. To test this incredible claim, the doctor decided to perform a simple check. He took a small metal instrument and heated its tip over an alcohol flame until it glowed a faint, menacing red. The heat radiated into the room. The nurses held their breath. Dr. Jenkins then pressed the glowing tip gently against Samuel's forearm. A sharp hiss filled the air as skin burned on contact. The nurses gasped. The doctor instinctively pulled his hand away. But Samuel, his expression didn't change. He didn't flinch. He didn't even tighten his jaw. There was just the faint, acrid smell of burnt skin rising from his arm. Stunned, the doctor asked, "Did you feel that?" Samuel just shook his head. "Nothing," he replied, his voice even. "Should I have?" Over the next few days, Samuel's story spread through the hospital corridors like a ghost tale. He became a living medical mystery. Young trainees and senior surgeons alike came to witness the man who lives without pain. They subjected him to every test their 19th century medical knowledge allowed. They pushed long needles deep into his muscles. They poured ice-cold water over open wounds. They applied blunt force to his joints and even used mild electric shocks to try and activate his nerve pathways. Each time, the result was the same. Samuel either watched the procedures with a detached curiosity or asked questions about what was supposed to be happening. One nurse was so disturbed by his lack of reaction that she wrote about it in her journal. She said, "Watching him was more frightening than watching a man scream. His silence felt unnatural, as if a fundamental part of human nature was missing from him." As the doctors studied him further, they uncovered the true tragedy of Samuel's condition. This wasn't a superpower, it was a curse. As a child, he would walk barefoot on sharp rocks without crying. He once placed his hand directly into a fire because he was fascinated by the color of the flames. By the time he was a teenager, he had fractured his ankle twice, severely burned his chest, and cut himself so deeply he nearly bled out, yet he never realized any of it was happening until someone else saw the blood. His parents, terrified for his safety, tried everything they could think of. They even tied bells to his wrists so they could hear him moving around the house, afraid he might wander into danger without a sound. But nothing worked. Pain, the body's natural alarm system, the very thing that protects every living creature from harm, was completely absent from his world. He was living life without any warnings. After weeks of observation, the doctors at Bellevue reached a conclusion that was both groundbreaking and deeply unsettling. Samuel suffered from a condition so rare that most physicians at the time didn't even believe it could exist. They diagnosed him with congenital insensitivity to pain. This meant that the specialized nerves responsible for carrying pain signals from his skin to his brain simply didn't function. He could feel temperature, he knew if something was hot or cold, but the searing, dangerous sensation of a burn never registered. He could feel pressure, but the sharp, piercing agony of a cut was completely lost to him. This diagnosis revealed a terrifying reality. He could bleed out without knowing he was injured. He could break a bone while simply walking down the street. He could suffer life-threatening internal injuries and feel nothing more than a dull pressure. Pain, the sensation that all of humanity fears and avoids, was the one thing missing from his life. And its absence was turning out to be more deadly than the pain itself. Samuel Hart's case didn't just end there. His medical files, the detailed drawings of his injuries, his temperature logs, and the results of his nerve tests were all carefully preserved. They became essential reference material for the next generation of neurologists and scientists. His case was a landmark, a turning point that helped the medical world understand some of the most fundamental aspects of human biology. From Samuel, they learned how pain pathways actually function in the nervous system. They realized just how essential pain is for our survival. His condition provided critical insights into how certain nerve disorders develop and how genetics can literally silence entire sensory systems within the body. But perhaps most importantly, Samuel's story forced the entire medical community to rethink its relationship with pain. For centuries, pain was seen as the enemy, something to be eliminated, silenced, and defeated. Samuel's life, however, showed them a new, more profound truth. Pain is not the enemy. Pain is a guardian. It's a warning system. It's the body's way of screaming, "Stop. Something is wrong." Samuel Hart's life was a walking paradox. He was a man who felt no pain, yet he lived with more daily risk than anyone alive. His quiet, calm demeanor hid a life of constant, unseen danger. His story reminds us of a haunting but vital truth. Sometimes, the very thing we fear the most is the thing that keeps us alive. The silence in his nervous system was louder and more terrifying than any scream. Thank you so much for watching. If you found this story as fascinating as I did, please hit that like button and subscribe for more deep dives into the strange and incredible corners of history and science. See you in the next video.